For people with chronic back pain, life can be a struggle to find relief, but now there is a procedure that can help. And joining me now is Dr. Cecil Graham from AZ Pain Centers, who also suffers from chronic back pain. It's good to go to a doctor who can understand what you're going through, and you've been a sufferer. So, and here you are now treating people in the same situation you're in.
I have a unique situation. Just about every patient that I see, I make the statement, I'm not only a pain specialist, I'm a fellow sufferer. I've been treating chronic pain for over 20 years and had a horse fall on me in 1993.
Ooh.
Pinned me to the ground, had a spinal fusion, 4 levels, L3, 4, 5, S1.
Wow.
Got to the point, like many pain patients, I could never understand how a patient would get to the point of suicide.
Wow.
And so over the last 20 years, I've had 7 patients that, you get the call the next morning and so-and-so committed suicide. And so I've always really searched for ways to treat something better and address it. Now legislatively they've addressed and said chronic pain is an issue that has to be dealt with. And through a friend, about a year ago, with my back issues, they recommended going to AZ Pain Centers. They had a friend that worked there.
Gotcha.
So I went and got the injections and was pain-free.
Ah.
So, started looking into it, the different therapies. For 19 of my years of practice, I put steroids everywhere, epidural steroids,
Sure.
facet injections, the common corticosteroids.
And what you do now over at AZ Pain Centers, this is non-steroidal injections, correct?
Correct. It's non-steroidal. It does not have the side effect profile of steroid injections, which adrenal gland suppression, gastric irritation, can even change your mentation, the way you interact with people. If you inject steroids into articular spaces, you can get bony erosion over time. What we use essentially has been used throughout the United States for over 20 years and essentially has no side effect profile. With steroid injections, you're limited to 3 injections in a year just because of the side effect profile. What we do is it's only limited on a daily basis by your body weight.
And do people see immediate results? Because I've heard from this before that, by the time they're leaving the office, they're already feeling good.
We have a combination of a couple of local anesthetics.
Okay.
It's a mixture that we use in with our anti-inflammatory substance. And the underlying cause of the pain is what you're going after. There's an inflammatory response. If you have, for instance, a disc approaching a nerve root, there's an inflammatory response at that site. And so we go in under x-ray guidance and place our substance right at that site. So you're always trying to treat the underlying cause of the pain to suppress the inflammation at that site.
Yeah, and I'm sure when you talked about some of these people who are suffering so terribly that they're contemplating taking their own life, they're on pain relievers, they're sleeping pills, everything, because unless you suffer with chronic pain, you don't know. It's every single moment of your life you've got aches and pains back there, and it's tough. It's debilitating, and this can actually help these people go from getting off all of those drugs, right?
Oh, the single biggest problem that we see, and it's various levels of it, but narcotics only affect your perception of perception of pain at the brain level. It's always best to treat the cause if you can. That's why
Sure.
we approach the site where the pain's being generated.
Right.
But narcotics, you develop tolerance over time,
Yeah.
dependence on it over time. You need a higher dose over time to get the same effect.
You're just masking the pain. Do you treat other things besides just back pain?
Oh, sure.
With this procedure? What other things can you treat?
Migraine headaches, tension headaches. There's always a big overlap in the headache population. We see tremendous results with headache. Fibromyalgia, which is kind of a basket diagnosis of pain problems with patients with diffuse pain complaints. But in spinal injuries,
Sure.
we have patients like myself. I've got a 14-inch scar on my back, and we have people with post-surgical pain, post-traumatic pain.
Do people need a doctor's recommendation to come see you?
No, they actually can call our clinic, and we have people that can walk them through the process and gather their previous studies. We do everything like any other pain clinic would do.
Absolutely. Very interesting. Very, I know a lot of people are out there suffering and they want to get it fixed and done with because it's an everyday issue and it can really affect your life. Thanks so much, Dr. Graham. Very good information. And if you do want more information about AZ Pain Centers, you can find them on the web at azpaincenters.com. There's the phone number right there on your screen, 480-821-PAIN.